for tutoring forever ago.
Yes.
Tell them how we met with Tracy, I thought it was.
Tracy, yeah. I was struggling on one little aspect.
I think it was cardio.
Cardio, it was hard. Somebody told me, well, hey, I have the holy hookup. So shared her name with me, and I just texted you, said yes, come on in, and
Yeah.
it was a match made in heaven.
Just tutoring.
Yeah, I had actually signed up for Boosta, and then after the nursing, tutoring, I thought, this is it. I'm gonna go with her. So yeah, I just forgoed the what,
500.
No, it was like 50 just a deposit, and then
Oh, you just did a deposit.
yeah, and so all the pink papers, those are amazing.
You remember your pink.
Yeah.
Tell them what year that was.
Oh my gosh, I took my test in 13, so it was 2012 I graduated.
Yeah, long time ago.
Yeah, it was.
Tell them what you've been doing, because you're amazing.
Oh wow. I became a private duty.
Like, sorry,
I have a little one too. I have a little one.
on that.
I became a Medicaid provider, private duty nurse initially. So I got my provider license with that within 30 days. So I was right on it. The second I passed my test, I got all my paperwork in. Did that for about a year and a half with, I did palliative care patients,
They know what that is now.
that were pediatric. So first patient, vent, G-tube feeding, seizure protocol, quadriplegic, and MR. That was my first patient. So
Thank God you don't care.
that was no, I love dogs. So that was my first patient, and then I would say after about a year and a half, 2 years, I'm like, I need to grow more at this. I just can't,
Can't limit yourself.
Yeah, so I started working for Cleveland Clinic, worked there for 6 years. Amazing. Got a lot of training there.
Yeah.
And anything
They're
I
the
would
best
say,
at that.
yeah, if you go, get involved in everything that you can. Like I did skin prevalence team.
Wow.
I did skin prevalence team, worked with wound care nurse. I did, we were on the biosafety team. So Cleveland Clinic, I was at a regional campus. We were one of the places. So if there was any kind of a nuke or any kind of chemical warfare.
Okay, bioterrorism, nuclear, chemicals. Yeah.
I got trained in that, and so we were just part of the team, it's just like so once you get your year in, start volunteering.
That's what we say. 1 year, just do 1 year, you go all over the place and do everything.
Do that, they'll train you. And then I started working with Neurotele.
Yeah.
So they would beam us up with the neurologist up at main campus, and I learned how to do all the neuro assessments, basically doing what the doctor would do. He's watching, and then we just do the whole protocol.
Yeah.
So did that. There's only like 3
as an
of us.
RN. Yeah.
Yeah, there's only 3 of us that did that.
The whole world. The whole world.
So I did that, and then then I started doing some travel nursing. Did that during COVID actually. I didn't know.
Oh, that's good stuff.
I didn't know that I took a cardiac tele job, and I thought it was gonna be cardiac tele, right?
With big.
I get on there and you got everything in, and like the last half of the day you go in, this is just your prep, and you kind of get oriented to the floor real quick, leaving. You only got 2 days to do it.
You get 2 days orientation when you travel. That's why they want you.
You better be ready to go. And so I just was talking to one of the gentlemen, and nurse, and I said, how many COVID patients do you have? And when I saw him kind of go, I said, he goes, well, because I know he didn't want to lose me, because I was ready to go, and they needed more people.
He didn't want to tell you the truth.
Yeah, he goes, well, actually, we're getting more and more. I'm like, what's
That's
that?
how you said it. We're getting more and more.
What's that mean? He said, well, we're actually now the designated COVID floor. And I went,
the whole floor. Oh my God, that's how H80 was at the clinic. It was a whole unit, was all COVID, and those nurses were
Yeah.
close.
So it was designated COVID floor, so.
You saw a lot of that.
I was a
And
little
life.
concerned initially if I was gonna take it, cause I have a special needs son.
Yeah.
And I thought, and this was like really at the beginning, nobody knew what was happening.
No vaccines.
And I had already, I knew I had COVID, cause we all had this crazy something at our house. It was President's Day.
President's Day, February.
Yes,
Wow.
so we had it, my husband had a client that was from China,
Oh no.
and we think that
Talk about
the whole family
Wow.
so had it, so we thought we had the bad flu before we knew what COVID was. And
Thank
so
God you were young.
it went through our whole family. And so guess what? I went through that whole COVID thing, not sick, nothing.
No,
I could
because you
be
got
around,
90 days at least
I could be
immunity.
around anything that
noticed
would
that.
bother
We
me.
know
I was
that's
just
fact. Yeah.
great, but
You were the best one to go through that.
yeah, it was
Yeah.
great. I mean, God provided for me
Yeah.
to be ready for that.
Yeah.
But I did have that little talk with my recruiter once I got in, the parking deck. I
Where
said,
is the cardio tally?
what's going on here? This is a COVID floor.
Need a little bit more money.
Yeah, I'm gonna need you.
No, here's
Here's
what
contract.
here's what I said. I said,
Rethink those
there's something called crisis pay.
Yes, yes. But what did she do? Negotiate.
Yeah.
I've been telling you guys, it's all in your power. She did not sit and go, well, it is travel. No, she called him back. What the fuck? Put on up her hip.
Because I was
Not
ready
quite
to
like
walk.
that, but we're praying for her.
But don't burn your bridges too, because you know that once you say no and you leave that, you're blacklisted.
Yeah.
So like, I didn't want to break my contract, but then I knew I had a special needs son at home. I'm like, okay, so I had to go home and just say I need to regroup for like, give me a good 8 hours to regroup. I went home, sat there, and talked to my husband about it. We prayed about it, and we said, okay, I'll do it. We kind of figured we all had what we had, but I was very cautious,
Yeah, real cautious.
So I did that, and then I just started last year. I LLC'd a Care for You.
LLC means she owns a company,
Yeah.
like I wish for all of you.
So now I'm just kind of in the midst of starting that. It would have been kind of up and going last fall, but my sister unexpectedly died, and my mother-in-law died. It was like 6 weeks. Yeah, it was unexpected. It might have been a COVID complication. I'm not sure. It was a hard situation. 57. So, yeah. Yeah. Right. So, and then my mother-in-law died within 6 weeks. So my husband and I had to kind of like regroup for a minute. And,
COVID is a bitch. It just was.
yeah.
People still don't believe it exists. I had a student that literally said, it's all made up. It's all
No,
made up.
it's there.
You want to kill her. Yeah.
I will say, I had a lot of Nepalese patients, and they were hit hard.
What state were you in?
I was in Ohio.
And you had what, Appalachian?
No, they were from Nepal.
Oh, Nepal.
Nepal.
Yes.
And,
Oh, wow.
they got it bad. Like 30-year-olds were getting it really bad.
Yeah, diabetics, obese, yeah.
Yeah. It was.
And just everybody, really, because you had no vaccines then when
No.
you first started.
No.
Yeah. Nobody could save themselves, right? What do you do? Tell the missionary work that you do.
Oh, actually, before I even started.
Before she ever
the other
came to me,
job,
she was a missionary.
God says give your first fruits, and so that's what I did. I went to Guatemala for the whole summer.
Yeah, and took care
So,
of them.
Yeah, it was. We were actually. I mean, I know now how dangerous it was, but I was kind of naive.
She
then,
ain't no
so-
shit. She's too young. Just want to save lives.
So we would go into the jungles, and we would have a translator, and sometimes we had to have a translator, and then the translator had to have another translator because it was such a different dialect.
Yeah, dialects are different.
So I did that. That was really neat. Totally will change your world if you do that. I would say
Especially how blessed you really are to live here.
do it first. Do it like before you. I mean, I did mine. That was the first
How
thing
did
I
you
did.
find out about it? Out of curiosity. With your church, right? Or no?
It was my friend's church.
Oh, okay, I know it's through some kind of church.
Yeah, and so
Most churches do.
my church wasn't doing one at the time, so I went and kind of checked it out, and I felt like it was a really strong team
Yeah.
and very prepared. So
Not their first rodeo.
yeah, actually, you're gonna deal with a lot of different things.
What's the most shocking thing you remember?
oh, I had a patient with leprosy.
Only in the Bible. Now you see it real in the country. Right.
And then the NP goes, you need to get his blood sugar. And I'm like,
I gotta touch him.
no, I didn't have a problem with that because,
Yeah.
but
You didn't know how.
he had no fingers.
And he had no toes.
Oh.
And I'm like,
Oh,
I'm
never
gonna
had.
do that.
Never
No fingers, no toes. Go get his blood sugar.
So I was like,
I'm a new nurse. I'm like,
how do I do that?
how did they tell you to do it? I don't even
They
know
did
how
it
to
right
do
here.
it.
We did it
What?
right here. Yep.
Shut your mouth.
Yeah, because it was like this. He didn't have anything. Didn't have anything. And like leg was
Nothing.
there, nothing here. And so I'm like,
Oh my God.
okay. So,
All right.
and then wound care when you didn't have really the same kind of supplies. And I'm
You're
like,
so
what do
blessed.
I do?
How do I prepare this?
And
So what was the most beautiful thing in your whole career? What should they look forward to? I say it's the miracles.
I would say know your stuff. Be willing to advocate for the patient. I had a paraplegic patient. I was almost done. I think I was working a night shift, almost done. And I went in to just check on him. I had him before.
Okay.
And he goes, something's wrong. He goes, I like to go like this. No, he can't feel. He's paraplegic. But I heard something. And I'm like,
Oh my
I
God.
knew I had a brand new nurse coming on that was and I was like, I'm not sure this is going to get followed up on.
So a new person taking your handoff report for the next shift.
Yeah.
Okay.
I didn't know if she would understand the severity of what
Hell
I was
no, they
kind of
don't know.
assessing.
Maybe brand
And
new.
So there's something not right there because I knew he wasn't somebody that would pontificate or anything like that. So
You wouldn't be whining.
yeah, so I went and I followed up with the physician and a couple others, and I left. I got everything. I knew. I said, "Now, are you sure you're coming up here? I make them guarantee me." I said, "No, you're not just telling me
the
this."
doctor?
Yeah,
Yeah. You gotta press them because
You
they'd be
know.
like, okay, I'll be up there to see him when.
yeah. And so
You sure?
you asked for a time.
What's your name? What time you coming?
Yes, and you put it in. Documented.
Yeah.
Documented.
Mhm. Cover your butt.
If something happens to him, it was on you.
Yeah.
So he I didn't see him. So that you think that's the end of the story. No, I was doing wound care, and I was doing skin prevalence. We were doing all the checks on the patients for pressure ulcers, and I'm like, what are you doing up here? He's now on an orthopedic floor. He was on a med-surg tele floor. Now he's on orthopedic, and so I'm like, he's like, yeah. He said, Amy, I had a spiral fracture, and
We learned that in school.
yeah, so he had a spiral fracture.
Oh my God, that's
And
because he stuck to the bed when
He went like this, and it just
Yeah, he's stuck. And we're doing I'm doing a pressure injury lecture about how your body sticks to the linen. And when you turn, you can get a spiral fracture because part of you is still attached
it's like
to
a
the bed.
twist fracture.
Yeah.
So, it was in his leg, and he actually, I think because that's what he said. He said I
And
went.
he didn't feel it, so he didn't even
But if
feel
I
it
didn't
to
listen
stop
to what
turning
he
that
said,
much.
I heard.
Damn,
And then,
that was that bone.
right. So I would say that was like when I felt like I listened to the inside.
And now he's on ortho. So shit is
Like,
crazy.
what are you doing here?
Right. Why?
Dad, you remember when you called the doc on that? You said I had spiral fracture.
Good thing you called.
Yeah. So, and I'm not sure
Because
that
change of shift, they
that
would not have called.
little gal came on. She didn't know what was happening really. So,
Yeah, see, it's from pies.
So she was trying, but I didn't think she'd follow up.
Yeah.
And so that's what happened. I said another time a person got put on a brand new med, and I did not think that they should be leaving
On that
right away. No, right away.
Oh.
And so I said, I negotiated with the doctor again. I said, I just don't feel comfortable with this at all. You're releasing them. This is a late at night admission. I don't feel comfortable with this.
They were sending them home?
Mm-hmm.
Oh my God. I told you question the discharge.
Mm-hmm. I did. I questioned discharge, and I said, she goes, you know what? We can just keep them till morning. I said,
Because they listen. They respect
Yeah.
and they listen.
yeah. So they kept them till morning, he had a cardiac event at 7 o'clock in the morning.
Oh my God.
And the family told me, they said, we're so glad we were here. And they said, we live in the country. There's no way we would have been able to get home. It's just like, listen inside. Like, you can have even all the best skills, and I know you guys will. I know you will.
Coming out of here.
But
I don't have a choice.
you still do those
We're
Saturdays?
still hard on them.
You still do those?
Say it again. I just yelled at them.
You just still do those Saturdays?
Yes.
Toe to toe is what builds a nurse. It's what builds you. I give my Saturdays to this. And they 4 people showed. I'm like, fuck y'all, I ain't coming here again. Nuh-uh. Y'all gonna have to pre-register and everything. I'm tired now.
Oh, it was at least this many of the Saturdays.
And they would clear that whole board. Tell them, please, that's the infectious disease board. Y'all would clear the whole board in one session. Because you were that good. They weren't playing. I'm about to get in y'all ass.
Have fun. You guys are going to have so much fun.
They don't know, do they? They don't know how much they know till they leave.
Yeah, and just,
It's very different from any other nurse.
you'll be
guys know a lot.
impatient in the beginning because you want to know so much more than what you do. But you're just going to have to go through hard stuff in the beginning. And you're going to mess up. You're
Yeah,
gonna,
no,
like,
fuck
do
you, shut up.
You are.
I had 3
You're gonna
med
feel
errors the
stupid.
first year.
You had what?
3 med errors the first year. I walked down the long hallway to the manager. I said, go ahead on and fire me. Because I know, like, you know, once you get a med error, you get fired, right? She goes, who are you? I said, my name is, and I told her my name. She said, pulled her glasses down. The fuck did you say? I said, I'm coming because I know that you fire people after med error. She was like, wait a minute. Aren't you the nurse that got a commendation from Dr. Frank your 3rd week here? And like no one's ever done that. Didn't I interview you personally at your interview? Get the fuck out of my office, you're fine. and it was that simple, because you're all gonna get a med error. You just all are. It's that simple. But I didn't know that. I was there for my firing. Get it over with. Fuck it. I go to Burger King. I know some people in high and low places. Get a job there.
I was on orientation and my orienter says, Heather wants to see you. I'm like, oh no, I've been here like a month. I sit down in the chair and I'm like,
It was Heather, your boss?
yeah, and so I'm sitting down and she's the nurse manager and I'm literally sweating.
Scared.
What did I do? And so I'm going through, okay, you know, so you're going through your whole day, your people, what could have, anything, like, could I have made a mistake? And I'm like, I don't think anything. And it was, Ed was my orienter. He was messing with me. It was April Fool's. I didn't
Please.
If I give them, you know, because you have that like hour window before and after.
Half hour before and half. We're gonna talk about
Yeah,
that.
and so I thought that I know I gave that one, that antibiotic a little too early. No, I thought it was early because I was trying to like, you know, be real efficient. And then they all just started laughing, and I'm like,
not cool.
So you just regain your composure after that.
Yeah.
You know.
I'm an April Fool's kind of person.
But they knew
I do that.
They figured they liked me if they were gonna mess with me that hard.
Yeah. It must get a kick out of you. I did an April Fool and it felt like lead. I called. I said I had to go down and get fit tested for my mask, right?
Okay.
At Cleveland Clinic.
Yep.
Fit tested for your N95. So while I was there, I was like, it's April Fool's. I'm gonna fuck with my bosses. I sent all of them, I'm so sorry, I can't come back to the unit, I have TB.
Oh.
They were making so many arrangements. They
Oh,
were
no.
so mad.
Oh,
Now, of course, we all laughed, but I thought it was a good one. I didn't wait that long.
Oh,
Just
no.
15
that one's high alert once you do that one.
And they were so mad because they had called this person in and that person was going to cover this, and they, you know, TB, you're going to be out a while. So they were trying to finagle. Oh my God, she's a hot shot. She does all this stuff on the unit. Now we need somebody that can do all that. So yeah, it was. It was a time and a place, I guess.
Yeah.
Now, of course, we party and laugh about it, but it wasn't funny so much then. All right, what advice would you give them before you leave?
Oh my goodness. The OMIG packet, definitely know
OMG is
that.
still around.
I definitely would know that. Like,
Your
sepsis.
test was in and out. You were done.
Yeah, sepsis protocols, definitely know those really well.
I
I
think
would,
I put sepsis in 3 different packets. That's how bad how serious it is. I put infectious disease, respiratory, and a lot of packets.
timely, very
Oh, it's
timely.
on the, oh, I got #1 poster for the world actually at the Cleveland Clinic. So I put the poster on. You can
Okay,
put that,
yep.
because it was voted #1 last year for Cleveland
Yeah.
Clinic Enterprise. Yeah, I forgot about that. It's back there
I
for
would
you.
say just take your time in the beginning. I would say one thing I would like to change in the nursing field is when you first go on your floors, the other nurses will not treat you nice.
She just said that. We're just talking
I don't
about
like that.
bullying.
I do not like that, and anytime, if you go to a really good institution, they'll do those little surveys, answer them honestly.
Yes, press Gainey they're called. Answer them honestly. Yeah. Ola, stop it.
Just answer them honestly, you know. And one day you'll be a person that has, you're seasoned and
You'll be a
change.
peer
You
pressure.
be the change agent, and that's what, like, when people come in, I wanna help them. I'm like, I'm not gonna make them feel inferior, hurt, you know, like, I know, like, okay, don't cry. I know you didn't get it the first time, it's okay. We're gonna do this. Be very positive, not
yes.
shaming them, not making them feel bad. So,
Remember how you felt
yeah, I
when you were
do.
new.
I didn't like it. I didn't like how the nurses were
They
so.
were mean, just outright mean.
The male nurses were actually better, guys.
Male nurses are better, and that's why they get picked up so fast. They can get any job they want. Like literally, Nestle has anything he wants. Yeah.
Yeah, I like to work with the male nurses.
No cattiness, no bitchiness.
No.
It's very different. Yeah.
Yep. Male nurses were very nice, and they're actually usually very strong too. So you know
The wimpy ones, I don't know.
you know, most of them were very strong. They could help you when you're.
Patient over your shoulder.
Right. She called me out the blue. Actually, I told you about another text. She texted me on a legal issue. I spoke on it earlier last week. And then she texted me about something she wants to give to me that my friend owns a home care company, and this will be such a big bonus.
Oh yeah.
Yeah, oh my God. So she has a big case because she's you guys are about to go away, right? What are you and your
We're
husband
probably
about to
in the
do?
next year. We're gonna build a house. So we've lived in the same house for 26 years.
Yeah.
Raised 5 children there. Came from the hospital there. So
Yeah.
like we're ready to like move to our next phase of life.
Yeah.
And
You're
so
trying to downsize, get things out of that
I just
house.
got a lot of
shit from missionary
stuff.
work.
I
and
have
everything else.
you know
Yeah.
a lot of.
It reminded me, one last thing, when she would come to tutor, we talked about her son.
Mhm.
I'm praying you can tell them about your birth, if that's okay. I never forgot it.
I can do it better now. I mean, back in the
Yeah,
day,
it
it
was
was
hard.
very difficult. I had a precipitous spontaneous birth.
What does that mean, precipitous?
Fast.
How fast? It's on your test.
Less than 8 hours.
3. Less than 3 from start to finish.
So that was my second child at 5. So my first one was C-section, and so the second one came out at home. Actually, we were outside. That's where you end up being birthed, just outside.
Wait, after your C-section?
Yeah, I was
After
doing
a
a VBAC. I was doing
She's
a
doing a
VBAC.
VBAC.
Yep, which every other child after even
Yeah.
the second one.
I had the highest VBAC rate in Ohio. In other words,
Yeah.
you went to me, you were quite successful with your VBAC.
Yeah, so he ended up coming out breech, got stuck. So
Guys know that's head entrapment.
yeah.
Okay.
It's just interesting how you'll because I'm a young mom. I was only like 22.
Didn't know anything about this stuff.
Right, my husband EMS there. We ended up delivering him in
The ambulance,
In the
and it hit the
ambulance.
floor.
yeah. Well, actually, as we were getting up to get in, is when I had the last contraction that brought him out because he was stuck head in. That's how it was. And they were taking us to the birthing hospital, which was, I think we were heading towards Akron City at the time. And as I got the last contraction, as they were putting the gurney up, he came out. They got him. We're in, and pretty much I was kind of helping with the whole
Resuscitate.
process. They're just telling me do certain things. I'm doing what I can. There's 2 guys over here trying to do what they can. My husband had he went and he got the bag, the suitcase. And he's like running from back to front. He's like, I'm going in that ambulance. So he jumped in the front. And
I ain't mad at him. That's a real man.
He said, I'm about to drive this.
Right. We going. We're getting out of here.
it was scary. And he was blue when I looked at that. I was like, oh my gosh. And so you get in this tunnel vision, as this is for me as a mom. And
Mama bear.
And I just started praying in the spirit. And
I love you. I never forgot it, Amy.
Never forgot you. And I never forgot your stories ever in my life. And how much you did for your son. And how you did it through school full time. Never forgot. You're amazing.
You are amazing. That's what I wanted them to see. How amazing you will be. You will be her.
Yeah, I didn't go back to school till I was
Good
my
He was
fifth
on the set.
one. Went to kindergarten. So, you know, you got a lot
And
of
she
years.
wanted to be a nurse from her experience of having to go through living hell with him every year to
He
different
lived.
things.
He did live. But I would say when I saw that, I just started praying
Advocating for
in the
her
spirit.
son.
That they're saying we don't have a heart rate, you know, the heart, you know, no pulse. And they were trying to intubate, but because he was a newborn, they didn't have newborn stuff in
No,
there.
it's just an ambulance.
So I just did like, there was no internet back in the day, so I just was remember what I had read in this magazine about
Magazine.
Poor magazine, and I knew God's word, so I just started praying in the spirit, and I said, in the name of Jesus Christ, I command you to breathe. And he started, like, I said, I command you to live in the name of Jesus, and like, they started getting his pulse started coming up. They couldn't, they were still bagging him. Now, don't get me wrong, it was
bad.
bad. But his pulse came up, and where he was not there, he became alive.
How old is he now, Amy?
30. Oh, 30 in 2 months. 2 months.
But who's counting? Only Mama Bear.
Yeah. Yeah.
Only she would know that.
He's
I mean,
still with us. You know,
Yep.
he still lives in my home. There'll be a process where, you know, we'll get him his own home, build it, whatever we have to do.
absolutely.
Thank you.
I went and lived in different countries to help him.
And you saved your money like we talked about in class.
You're always laughing about that. My husband and I were very good with our money from the very beginning. And so there was a point that like we really didn't even have to work, and she was like, "What? This is great." And
She didn't have to work the whole time she came to me.
And so, which the 5 kids was enough work.
That was more work than us.
My first job, the lady goes, it was Heather. She goes, "Is there a reason why you didn't have like an aid job or something while you were in
nursing
nursing school?" And I
assistant.
said, "Ma'am, I just said I was kind of busy. I have 5 children, and I was trying to make one special needs. I was trying to make sure everybody was balanced during that time."
And alive.
She goes, "I have 1."
Which is not even a comparison. Plus, you're a nurse for your son.
Yeah. So I knew GI very well because he had a lot of GI issues.
Tell them the things he had, everything that was wrong, and what you had to deal with as a mom and advocate.
Currently he's nonverbal, but I know what he knows what we're saying. We have communication devices. He's G2 fed. He had a Nissen fundoplication and a pyeloromyotomy.
That's in your packet, GI.
When he was 18 months old. So primarily he gets most of his nutrition via the gastrostomy tube. The Nissen keeps him from refluxing.
It does.
The pyeloromyotomy opens up part of the stomach, the top part of the stomach, so that there's better gastric emptying. And he has cerebral palsy. So basically that just means there's an injury to the brain. There's a lack of oxygen. So I just tell people if
Cerebral palsy.
somebody put a bag over your head for 6 minutes, you're not going to be the same. So basically he's stuck for 6 minutes. And because he was a baby, he had neuroplasticity, so he's able to regain a lot of functions that they never said he would. They told us to put him in pre-antenatal and not take him home.
Hattie Larlam was a long-term care facility for children with cerebral palsy and other conditions that they believe there's no way parents could probably do this, but she was determined.
We had to suction him probably every 10 minutes when we brought him home. He couldn't swallow his own secretions. He had an NG tube initially. I kept that for 18 months, and he was on a drip feed that he only was able to get 15 cc's per hour, 15 mLs per hour. So he's on a continuous feed.
In a rural area. all by
Heart monitor.
herself with
He was
her
on
husband.
heart monitor.
Yeah,
So, and I had 2 weeks of nursing care when I brought him home.
2 weeks, home care.
So we
It's
put
all up to her
we just put
and daddy.
we put a recliner in his room and we would sleep in there. You know, and you can't let them sleep on you. You know, you have to sleep in bed, so you're sleeping next to them.
Your whole life changed.
At 22.
I'd say she deserves a hand.
No, you guys all do. You're in the thick of it, and it's hard. You guys are gonna be great.
Haven't seen you in probably 12 years.
I know. That's
They
great.
pop in, you guys. It's a family. You're
Yeah.
like a mafia. Once you're in, you can't get out.
Yeah, little questions though, like my friend works at nursing homes. I've never worked in nursing homes, so she had this situation, and I texted. I was right, but I said, don't
Don't
to the
talk to the
nursing
board without a lawyer. Remember we talked about that last week? That was her text.
Yeah, my friend Cheryl was like, I'm like, stop it.
Go
Go into the med room now. Get away. You know,
Don't talk to him without a lawyer.
no.
That's boss.
So
Telling y'all.
So I said, man, I'll even pay for your lawyer. Get at least the first
This one.
consult. She went and got the consult, and they're like, do not talk to them unless
They
you.
agree.
He said, let us. We'll do that.
We'll do all that.
So really, for I think it was like $3,000. They would handle it all.
Yeah, 3,000. That's why you save your money, because you don't know when that might happen to you. You are very frugal when you get this new job, and you're saving your money and you're putting away, and you're saving for a rainy day. And it was a fucking hurricane storm in her life, and 3,000 hard to come by if you ain't got it.
Yeah, and I had never done nursing home care, so I didn't really know like how that whole like. I've only done hospital stuff, so I'm like, I know that this is a no. Don't talk to them.
Don't
'Cause
talk to them. I teach
wouldn't
y'all
have
that.
known that unless you had said that.
'Cause no one
I just
teaches
gleaned
that.
it from picking it up in this class. She's like, they're not for you.
They're not your friend.
I'm like, really? You know.
Board of Nursing, they're my friend. They
Doesn't it
call. I'll
sound
call
like-
them back.
doesn't
No,
it
you
sound
ain't.
Nice. Nice. I'm
Yeah.
like, yeah, I would think that. They're there. No.
No, they're a piece of shit. Yeah.
Nope.
you know me, I'm bad. They're not. Some of them are really kind, loving people, but then others have their own agenda, and that is what we see. And I'm sorry, but I don't really have anything to hide, and I'm not afraid of anybody, so I'll tell you what it is. They can be your worst enemy, period. And it's on tape, and I don't give a fuck.
So I had a friend, he's in, he does regenerative farming, and guess what he said? He said, he does different things. He says, like talks to like.
Yep.
He said, don't go talking, you know, like in his realm, he was kind of pushing the threshold of different things. He said, like talks to like.
Like talks to like. Stay in your lane. Don't talk to them people.
Yeah. So get yourself an attorney if you ever have a problem, I guess.
She'll be embarrassed. I'm gonna say it anyway. She came to me after all was said and done, and I still have it.
What?
With all these gold coins. Like for real. Like no, for real. Like I'm like, she crazy. And I still have them because they're extremely valuable, obviously, but she's more valuable.
Oh.
And the memory of her being in my class with that son, with that story of birth from hell, and what she did at Tri-C, and how she did it, and how she was having problems and nobody was really helping her get through cardio, and how she was just so thankful to get through cardio. It was cardio. It was all about cardio. And then she's like, okay, well, forget boost. I'm just going to go here. That's fine. And then 75, and out. So you won't forget the people you get to know in this field ever. You won't ever forget them. I won't ever forget you guys. You think that I will. I didn't remember your bump on your left leg. But I never really forget you. 12 years later, I was like, hi, Amy. She probably was shocked. I was like, hi, Amy, because what I tell you about my phone, I don't get rid of any numbers. I don't get rid of any text messages. They're all there from the day you met me. They're all there. When you pass your LPN, they're there. I can pull up that 17-year ago text. Well, it wasn't 17, but it was to be 13 easy. Like, I passed. It's all there.
Yep.
Yeah, so good luck.
Yeah.
Well, we're gonna have the guys, 2-3 guys, help her with this big, huge thing that she has to bring up for my friend's thing. We have empty rooms and stuff.
Okay,
So
good.
it'll be good if you guys could go with her to help her out. She has